Hello and welcome to today's vocabulary lesson. We are going to learn some words connected to health. So welcome back. So as I mentioned, we are going to look at health-related vocabulary, and these words could be used when answering questions about how to keep healthy, about how healthy your diet is, or doing exercise, or even questions about illnesses. So let's have a look at people and adjective words connected to health. And the first two words we have are idiomatic expressions. So a health nut and a couch potato. So a health nut is someone who is very interested in keeping healthy and doing exercise. They're always doing some kind of physical activity. They're always thinking about how healthy they are with their activity and with their diet. A couch potato is in many ways the opposite. They spend all their time on the couch. They don't do a lot of exercise. They don't care very much about their health. Another person related to health is a personal trainer, someone who can help you to be healthy, who can teach you about the correct exercise and correct foods to eat in order to be healthy. A nutritionist, in a similar way, it teaches you about food, what food is good for you, what food is bad for you. A general practitioner is a term for a doctor. So your local doctor, if you get sick, you will go and see your general practitioner, often referred to as a GP. We also have some adjectives related to health here. To be lean or trim is a positive adjective to say that you have a good shape. You are very lean, you are not fat, you have quite a healthy shape or a healthy body. The opposite, of course, being fat and obese. So obese is more extreme, but obviously it means unhealthy. You are too big for your height. Muscular, to have muscles. If you lift weights, you will be quite muscular. To be active or to be sedentary. So these are opposites. Active means you move a lot. You do a lot of physical activity. And sedentary means you don't move a lot. You sit down a lot. So a job where you sit in your office all day, that is a sedentary job. But an active job of delivering goods, you're always moving, that's an active kind of job. Now let's look at things you can do to keep healthy. And you can have regular checkups, go to the doctor regularly to check your health. Get 8 hours of sleep is generally the recommended number of hours in order to have a healthy sleep. Exercise regularly, eat a balanced diet, no smoking or drinking. These activities generally are recommended if you want to have a healthy lifestyle. We can also do some other activities. Do yoga, to meditate. Be hygienic, means to wash and to shower and to clean yourself. Reduce stress, find ways that you can reduce the stress in your life. And be sociable. So being sociable will keep you mentally healthy. Okay, having friends, having connections, having people to talk to can help you mentally. Let's move on to talk about health problems. So again, this could be a topic in part one or even a part two topic card for IELTS. Talk about a time when you were sick. Talk about an injury or illness you have had. So let's look at some of these health problems. To have an illness or a sickness, to have a disease, a broken arm or some kind of broken bone, a broken wrist, a broken leg. To have a headache, a very common problem. Perhaps this is a regular thing for you. A cut or a scratch. So when a sharp thing, a knife or a piece of glass might cut through your skin. A sore throat. So when we cough, and we might have a sore throat. Have a cold or the flu. And a bruise or a rash, which is a mark on your skin. If someone or if something hits you very hard on your skin, the skin will change color, go brown or red, that is a bruise. And a rash is usually a reaction to a chemical or perhaps an insect. Your skin will go red and become itchy. And a runny nose is another health problem, especially in the winter, or if you have flu, you might also have a runny nose. Now looking at treatments, ways to overcome your health issues. If you have one of these problems, you might use one of these treatments. So medicine to treat illnesses and diseases. Tablets and pills is how we take the medicine. To get some rest. Sometimes the only way to get over a headache is to rest. A band-aid or plaster we would put over a cut or a scratch to stop the bleeding. Antibiotics might be needed to stop yourself from becoming even sicker. Traditional remedies, so perhaps traditional in your country, traditional ways of treating a headache or a runny nose. Surgery for big problems, especially big injuries like a broken arm, or if you have a serious disease, you may need surgery. An injection to have a needle to overcome an illness. And lozenge or syrup, we take these to stop a sore throat. And the final treatment I have here is cream or ointment to overcome a rash, to make your skin feel better. If you get sunburnt, then you might have a cream to make your skin not sting, not feel bad. So those are just some ideas, some words we can use when we're talking about health-related topics. And I will create another video where I'm using these words in sentences. But just think about the words, think about how you can use them. Think of any past speaking questions you've had where you have to talk about health or keeping healthy or any health problems you've had. Think about how you can use these topic-specific words. Remember, we really do want to increase our vocabulary score by being very specific. Don't just say, oh, I had a problem. Say what the problem was. I had a headache and a runny nose. Is much better than I didn't feel good. So try and be specific with topic-specific vocabulary. So thank you for watching this video. Please subscribe to the YouTube channel so you can get more practice for the IELTS exam, and watch another video to continue increasing your vocabulary or your listening skills or some of the other skills that I have available on the YouTube channel. Thank you and goodbye.